Yeah, and again, just reiterating that herd immunity, and again, a term taken sometimes from veterinary epidemiology, where people are concerned in animal husbandry with the overall health of the herd, and an individual animal in that sense doesn't matter from the perspective of the brutal economics of those decision making. Humans are not herds, and as such the concept of herd immunity is generally reserved for calculating how many people would need to be vaccinated in a population in order to generate that same effect. So I think we need to be really careful when we use terms in this way around natural infections in humans, because it can lead to a very brutal arithmetic which does not put people and life and suffering at the centre of that equation. What also does concern me in this narrative is that there was an assumption as this disease spread around the world that we're really just seeing the severe cases and the difficult cases. And when the seroepidemiology comes, it will demonstrate that most of the people have been infected and this will all be over and we'll go back to normal business. Well, the preliminary results from the seroepidemiologic studies is showing the opposite. It's showing that the proportion of people with significant clinical illness is actually a higher proportion of all those who've been infected, because the number of people infected in the total population is probably much lower than we expected. And as Maria said, that means we have a long way to go. And it means, as the Director General has been saying for months, this is a serious disease. This is public enemy number one. We have been saying it over and over and over and over again. And we really do need to now step back and sort of recalculate this as a mild illness and effectively make the same mistakes we made the first time round in terms of not taking this seriously and not putting in place the necessary measures. We have a second chance now as a society to put in place the necessary public health interventions, to put in place the necessary community support, to support our vulnerable populations, be they in long-term care facilities or be they in refugee camps. No one is safe until everyone is safe. And again, when we look at the epidemic around the world, and we see that in some countries over half of the cases have occurred in long-term care facilities or workers in those facilities. We need to look at these hotspots, at these really, really terrible situations in which we either haven't properly shielded people in those situations or protected them. So I do think this idea that, well, maybe countries who've had lax measures and haven't done anything will all of a sudden magically reach some herd immunity, and so what if we lose a few old people along the way? I mean, this is a really dangerous calculation. And not one I believe most member states are willing to make that arithmetic. Member states, responsible member states, will look at all their population. They value every member of their society, and they try to do everything possible to protect health, while at the same time, obviously, protecting society, protecting economy and other things. We need to get our priorities right as we enter the next phase of this fight.